Osteoarthritis is one of the musculoskeletal diseases and is the second greatest cause of disability. It is a long-term chronic disease characterized by the deterioration of cartilage in joints, which results in bones rubbing together and creating stiffness, pain, and impaired movement. Based on Ministry of Health Malaysia, osteoarthritis is a progressive joint disease due to failure in repair of joint damage. Commonly affects the joint in the knees, hands, feet, and spine, and is relatively common in shoulder and hip joint.
According to United States, by the year 2050, people aged over 60 will account for more than 20% of the world population. 50% of them will have symptomatic osteoarthritis, and one-third of these people will be severely disabled. According to the Ministry of Health Malaysia, the knee osteoarthritis is estimated to be 10 to 20% of the total adult population, while the hip osteoarthritis is less common with only 2.2%. The osteoarthritis among the three main ethnicities in Malaysia accounted for the Malay are 44.6%, Chinese 23.5%, and Indian 31.9%.
OA can be primary or secondary. It has multifactorial etiology and can be considered the product of interaction between systemic and local factors. Systemic risk factors for OA. Age, the risk of developing OA increases someone gets older because bones, muscles, and joints are also aging. Gender, greater in women than men. Breakdown of cartilage, increased frictions in joints. Genetics, hereditary, hormones changes, example, estrogen deficiency in menopause women. Diet, low vitamin C and E which for formation of collagen, low vitamin D, increased risk progressive of OA. Local risk factors, congenital joint malformation, unusual joints at birth. Joint injury and trauma, a break or tear can lead to OA after years. Obesity puts more stress on joints. Occupation, repetitive and excessive joint loading, example, manual labor. Physical activity or sports, sports involving high impact forces directly to joints, example, weight bearing. Lifestyle factors, sedentary lifestyles, cracking knuckles, wearing high heels, alcohol abuse, smoking may raise levels of toxins in the blood. Etiologies are secondary osteoarthritis, post-traumatic, congenital or malformation, unusual joints at birth, malposition, varus or bulgus, post-operative, got crystal deposits in the cartilage, rheumatoid arthritis, joint damage and cartilage breakdown, metabolic such as rickets, hemochromatosis, chondrocalcinosis, or chronosis.
The symptoms for osteoarthritis are joint pain, stiffness, swelling, gait disturbance, bone swelling, loss of muscle bulk, limb deformity, tricky organ succession, and instability. Further signs are abnormal gait, tenderness, joint swelling, crepitus, limitation of motion, and deformity.
Pathophysiology. The dynamic equilibrium between the formation and breakdown of the cartilaginous matrix is regulated by interplay of anabolic influences and catabolic influences. An active response of chondrocytes in the articular cartilage and the inflammatory cells in the surrounding tissues can cause degradation of cartilage. The release of enzymes from these cells break down collagen and proteoglycan and destroying the articular cartilage. When it exceeds the system ability to compensate, matrix degradation occurs which can progress to osteoarthritis. Clinical investigation, physical examination, coarse crepitus, joint line tenderness, bony swelling, deformity, reduced ROM. Imaging and laboratory assessment, ultrasound or magnetic resonance imaging, inflammatory markers, synovial fluid examination to indicate if there is suspicion of persistent crystal deposition.
For the non-pharmacological treatment, there are self-management to teach patients about behavior modification, therapeutic ultrasound and electromagnetic field treatment used for knee osteoarthritis to relieve their pain and improve physical function, braces and orthodos to correct the body axis, and lastly, exercise to reduce pain at least for 6 to 12 months. The pharmacological treatment for over-the-counter painkillers, there are acetaminophen and NSAID to relieve pain, but NSAID can cause stomach irritation. Chondroitin, used alone or combined with glucosamine, are substances that found in healthy cartilage and joint fluid, while the topical and oral herbal therapy that includes amicagal, confrigal, clexidine, extract of Boswellia serrata, capsaicin, salicylates, and menthol act as counter-irritant to relieve pain. The prescription drugs for osteoarthritis when the condition are severe include the NSAID with stronger dose to relieve the pain, steroid injection or intra-articular injection treatment, which include the corticosteroid and viscose supplementation, will reduce the inflammation and swelling. The hyaluronic acid injection will serve as a shock absorber. The antidepressant, opioid and androsterone helps to reduce the pain, while the doxycycline are potentially to slow cartilage degeneration for the knee osteoarthritis.
Surgical treatment.
Number 1. Arthroscopic surgery. Loose cartilage was removed to repair the cartilage tears and smoothing bone surfaces. Number 2. Total joint replacement. Damaged joints replaced with artificial joints. Number 3, partial joint replacement. Damaged tissues and bone in the knee joint were removed in certain part and replaced with prosthetic. Number 4, corrective osteotomy near the joint. It involves a cutting bone to redistribute weight on the joint and make it more stable for young patients. Number 5, joint fusion or arthrodesis. Two bones are fused together on each end of the joints to get rid of the joints itself when joint replacement is not effective. Number 6, abrasion arthroplasty. Intensive multiple tissue debridement as alternative to total knee replacement. Number 7, autologous osteochondral transplantation (OCT). A healthy piece of joint tissue is transplanted to replace the chondral defects for knee OA. Number 8, autologous chondrocyte transplantation (ACT), an advanced cell-based autobiologic technology to treat chondral defects on knee OA.
Prognosis of patients with OA depends on which joints are affected and whether or not they are causing symptoms and impaired functions.
The osteoarthritis patient may have the impairments of joint swelling, weaker strength, abnormal gait, limitation of range of motion, and deformity or malalignment. The patient also unable to grab small objects, reach above one head, sit or stand for about 2 hours, lift or carry more than 5 kg, climb a flight of stairs without resting, push or pull a heavy object, walk about 35 miles, and stop, bend or kneel. Last but not least, patient also may have social and cognitive